All right, diving into this research on knee pain, lots of stuff about the ACL in here. It looks like someone's either dealing with knee issues or really wants to avoid those nasty ACL injuries.
Yeah, you got it. And it's fascinating, To really get what's going on with the knee, we gotta look beyond just the knee itself.
Okay, now you've got me curious. Explain that for me and for our listeners, of course.
So think about it this way. Your knee, it's just one part of a bigger system, The kinetic chain of your leg, what happens up at your hip, that can directly impact what's going on down at the knee.
So it's not just the knee, it's how the whole leg moves. The whole thing works as one unit.
Exactly. And a big player in all of this is the hip joint. It's a ball and socket joint, which means it's super mobile. It's got this wide range of motion, but that also means it needs good control, good stability.
So if the hip isn't stable, could that actually be the root cause of someone's knee pain?
Absolutely. If those muscles around your hip are weak or they're not coordinating right, it can mess with how your femur moves, your thigh bone, and that can then lead to abnormal stress on the knee joint, which can lead to pain, discomfort, even more serious injuries down the line.
Whoa, that's a game changer. So listener, if you're struggling with knee pain, it might be time to kind of shift your focus up to the hip and see what's happening up there.
Now, to get a little bit technical, how different movements affect the knee. One of the research articles you sent over looked at how people land from a jump, focusing on what we call the sagittal plane. You familiar with anatomical planes?
I am. I'm sure our listener would love a quick refresher, though.
Sure. Imagine 3 sheets of glass cutting through your body. One from front to back, one side to side, and then one horizontally. Those are your anatomical planes. Sagittal, frontal, and transverse. They help us describe movement in a very specific way.
So with this jumping study, sagittal plane, you're talking about the forward and backward motion of the body during that landing.
Exactly. And what they found was that landing with a straight, upright trunk, like really straight, that put way more stress on the knee extensors, those quadriceps, the muscles on the front of your thigh.
Yeah, that makes sense, right? I mean, you're landing straight up and down. Your quads are doing most of the work to absorb that impact.
Right. But here's the interesting thing. When the study participants, they landed with a slight forward lean, it shifted that load to their hip extensors, specifically the gluteus maximus.
Hold on. The gluteus maximus. So it's not just for, appearance.
Oh, no, not at all. It's super important for stabilizing your hip, controlling how your femur rotates. A strong gluteus maximus can really take a lot of that stress off your knee joint, especially when you're landing from a jump or any activity with impact,
Listener, think about the last time you landed from a jump. Did you notice a difference in how your knee felt depending on how you landed? I bet you did.
I think we've all felt that. Now let's shift gears. Think about the knee like a bridge, okay? It's designed to handle forces coming from above and below, what we call compression.
Like the pillars of a bridge, supporting all that weight from the structure above.
Precisely. But bridges aren't so good at handling forces from the side, what we call tension. And just like a bridge, the knee, it's not designed to withstand a lot of sideways force.
So you're talking about that dreaded knock-kneed look that we see sometimes, especially in female athletes, where the knee kind of collapses inward during movement. That's called dynamic knee valgus, right?
You got it. And weak hip abductors, they're often a big contributor to that. They're just not strong enough to control that inward motion of the thigh, which puts a ton of strain on the ligaments of the knee, including the ACL.
So this is a big one for our listener, especially if you're an athlete. Those strong hips are absolutely essential for protecting your knees.
And this brings us to a really critical point about the ACL itself. It's amazing how much research has gone into understanding why women are so much more prone to those non-contact ACL injuries. We're talking 4 to 6 times more likely than men.
That's a crazy statistic. What's going on there?
Well, one key factor seems to be the way women tend to move, especially when they're landing or changing direction quickly. Research shows that women often land with less hip and knee flexion, greater dynamic knee valgus, that inward collapse we just talked about, and an over-reliance on their quadriceps.
Wait a minute, this is all starting to connect now. So so are you saying that this specific movement pattern combined with weaker hip muscles, that's what's putting women at a much higher risk for ACL tears?
That's exactly what the research is suggesting. And it's not just speculation either. Several studies have actually shown that hip-focused training programs, they can actually change those movement patterns and
Ah.
potentially reduce the risk of ACL injuries.
This is where it gets really interesting. One study even showed that just 4 weeks of targeted hip training that led to significant improvements in landing mechanics. They had better knee and hip flexion angles and reduced knee valgus moments. All good news for ACL health.
Yeah, that's a fantastic example of how we can use this knowledge to create practical solutions, And it leads perfectly into our next topic, revophysiotherapy.
Right. They're all about taking this cutting edge research and applying it
Yeah.
to real world situations, helping people overcome knee pain and dysfunction.
Absolutely. Everything we've been talking about, the kinetic chain, hip strength, landing mechanics, these are the very principles that revophysiotherapy uses to assess and treat their clients. They understand that to truly address knee issues, you got to look beyond just the knee itself.
So they're not just treating the symptom of knee pain, they're looking for the root cause, which often lies in the hip or even further up the kinetic chain.
Precisely. They take a holistic approach, evaluating hip strength and mechanics, trunk control, and overall movement patterns. It's about understanding how the whole body works together, not just focusing on one isolated area.
Which makes perfect sense considering everything we've learned about how interconnected our bodies really are. And even if you're not a Revo client, listener, understanding these principles can help you choose a physical therapist who takes a similar holistic approach to knee pain. It's about finding someone who sees the bigger picture and understands that complex interplay between movement and function.
That's an excellent point. Now let's move on to discussing ACL injuries specifically. We've touched on some of the risk factors, but let's dig a little deeper into the mechanics of these injuries and how they relate to hip function. Welcome back to our deep dive into knee pain and that fascinating connection to hip mechanics. We left off talking about how revophysiotherapy uses all this stuff to help their clients, right?
Yeah, and I think it'd be helpful to kind of dig a little deeper into how those connections between the hip and the knee actually play out in ACL injuries. We talked about the stats, how women are 4 to 6 times more likely to have non-contact ACL injuries than men, but I'm curious about like the biomechanics behind that.
That's a great question. One of the research articles you sent over actually breaks down the anatomy of the ACL and how forces are traveling through the knee during different movements. And it turns out that the ACL is especially vulnerable during movements that involve like rapid deceleration, pivoting, or landing awkwardly.
So it's not just the impact itself, it's like the combination of forces and like the direction of those forces that can put the ACL at risk.
Exactly. And remember those specific movement patterns we talked about earlier. Less hip and knee flexion, greater dynamic knee valgus, that inward collapse, and an over-reliance on the quadriceps. Those patterns can actually increase the strain on the ACL during those vulnerable movements.
It's like this perfect storm for ACL injury. The anatomy of the joint, the movement patterns, and the forces involved all kind of conspiring to create a higher risk.
That's a great way to put it. And this is where hip strength and mechanics become so crucial. Strong hip muscles, particularly those hip abductors and the gluteus maximus, they can really help control those movement patterns and reduce the strain on the ACL.
So it's not just about strengthening the muscles around the knee. It's about training the whole system, including the hip, to move in a more coordinated and stable way.
Precisely. Yeah. And it's not just about preventing injuries either. These same principles apply to rehabilitation after an ACL injury. Revophysiotherapy, for example, they focus on strengthening the hip muscles and improving overall movement mechanics as part of their post-ACL surgery rehab protocols.
That makes sense. If weak hips contributed to the injury in the first place, then it makes sense that strengthening them would be a key part of recovery and preventing future problems.
Absolutely. And here's where it gets even more interesting. There's growing evidence that these hip-focused training programs, they might not only be strengthening the muscles, but they might actually be rewiring the brain, improving that neuromuscular control and coordination.
Wait, rewiring the brain. So it's not just about building bigger muscles. It's about improving how the brain is communicating with those muscles to create more efficient and stable movement patterns.
That's the idea. It's like upgrading the software, as we talked about before.
Yeah.
And it just shows the incredible plasticity of the human body, our ability to adapt and change in response to training and experience.
So even if someone has already had an ACL injury, there's still hope that they can retrain their brain and body to move in a more protective way.
That's right. And this brings up an important point about the concept of prehab, which is basically doing exercises and training to prevent injuries before they even happen.
So it's like taking proactive steps to strengthen your weaknesses and improve your movement patterns rather than waiting until you're injured to address those issues.
Exactly. And it's not just for athletes either. Everyone can benefit from prehab, whether you're an avid runner, a weekend warrior, or just someone who wants to maintain their mobility and independence as they get older.
That's a powerful message. It suggests that we have more control over our health and well-being than we might realize. But let's get back to those training programs for a second. What are some of the key components of a hip-focused program that's designed to improve knee health and reduce ACL injury risk?
Well, first and foremost, it's essential to assess for any muscle imbalances or weaknesses. We talked about how weak hip abductors are a common culprit. So exercises like side lying, hip abductions, and clamshells can be really helpful for strengthening those muscles.
And the gluteus maximus is another key player.
Yeah.
We talked about how important it is for hip extension and stability. What are some good exercises for targeting that muscle?
Hip bridges are a great option. They're relatively simple to perform, and you can modify them to increase the challenge as you get stronger.
And they don't require a lot of equipment, which is a bonus.
Right. And there are other variations you can do, like single leg hip bridges or hip thrusts to further challenge the glutes and improve stability.
And what about those dynamic movements we discussed? Landing, pivoting, cutting. How do we train for those in a safe and effective way?
Plyometrics are a great tool for developing power and control during those types of movements. Things like box jumps, jump squats, and lateral shuffles can be incorporated into a training program, but it's crucial to progress gradually and focus on good technique.
And this is where a qualified physical therapist or trainer can be so valuable, right? They can assess your individual needs, create a customized program, and make sure you're performing the exercises correctly.
Absolutely. They can also help you identify any underlying movement restrictions or asymmetries that might be contributing to your knee pain or increasing your risk of injury.
Speaking about asymmetries, I'm curious about the role of single leg exercises in these training programs. I've heard they're important, but I'm not really sure why.
Single leg exercises are fantastic for challenging balance and improving stability in the hip and knee joints. They force you to control your movement on one leg at a time, which is essential for activities like walking, running, and cutting.
So they're mimicking those real life movements where we're not always perfectly balanced on both feet.
Exactly. And they can help identify any weaknesses or imbalances between the left and right sides of the body.
So if one side is weaker, it might be compensating and putting extra stress on the other side and increasing the risk of injury.
That's a great point. And by strengthening those weaknesses and improving balance, we can create a more symmetrical and resilient foundation for movement.
This is all starting to make so much sense. We've talked about the importance of hip strength, the biomechanics of ACL injuries, the concept of prehab, and the value of training programs that target both the muscles and the brain. It's truly a holistic approach to knee health.
And I think it highlights the importance of taking an active role in our own well-being. We don't have to just passively accept knee pain or injury as an inevitable part of life. By understanding how our bodies work and how movement affects our joints, we can make informed choices to protect ourselves and improve our quality of life.
It's empowering, isn't it, to realize that we have the power to influence our own health and resilience. But before we get carried away, let's bring it back down to earth for a minute and talk about some specific examples of exercises that people can start incorporating into their routine.
Sounds good. We've already mentioned a few like side lying hip abductions, clamshells, hip bridges, and plyometrics, but there are many others that can be beneficial for improving hip strength, stability, and overall movement mechanics.
Let's dive into some of those examples in our next segment. I'm sure our listeners is eager to hear more about how they can put all this knowledge into practice. Welcome back. Ready to hear more about those exercises, all those things we can do to strengthen our hips and protect our knees.
All right, so let's get specific. We talked about some foundational exercises like those clamshells, hip bridges, but let's add to our repertoire here. Remember, it's not just about isolating individual muscles. It's also about integrating movements that mimic how we use our bodies in everyday life.
So exercises that challenge our balance, our coordination, like those single leg movements we were talking about earlier.
Yeah. Exactly. Think about lunges, for example. They're a fantastic functional exercise that works tons of different muscle groups in the legs, the glutes, quads, hamstrings, all of them.
And you can do them in so many different ways too. Forward lunges, reverse lunges, lateral lunges, all targeting different muscle groups, different movement patterns.
Right. And if you really want to challenge your balance, your stability, try walking lunges or lunges with a torso twist.
Ooh, those sound tough. Gonna have to give those a try. What about step ups? I've seen people do them on benches or boxes at the gym, but I never really thought about the benefits for knee health.
Step-ups are great for strengthening the quads, glutes, and calves, and they also really challenge your balance and coordination as you're stepping up and down.
And you can do those anywhere. You can use a staircase, a park bench, even a sturdy box at home.
Exactly. And you can make it harder by holding weights or wearing a weighted vest.
Now, you also mentioned single leg deadlifts earlier. Those sound a bit more advanced.
They can be, yeah, but they're incredibly effective for strengthening that posterior chain, the muscles along the back of your body, like the glutes, hamstrings, and lower back. Those muscles are essential for hip extension and stability, which, as we've talked about, are so important for protecting the knee.
But I imagine form is really important for these, right? I wouldn't want to injure myself trying to do something too advanced.
You're absolutely right. It's essential to start with lighter weights and just focus on mastering that movement pattern before you increase the load. And if you're not sure about your form, it's always best to check with a qualified trainer or a physical therapist.
This is all great info. So we've got lunges, step-ups, single leg deadlifts, all targeting those essential hip muscles. Are there any other exercises we should add to our toolkit?
Well, don't forget about squats. They're a classic compound exercise. They work multiple muscle groups at the same time, quads, glutes, hamstrings, even the core muscles.
I love squats. They make me feel strong and powerful.
Yeah, they're great for building overall lower body strength, but just like with the deadlifts, form is super important. Make sure your knees are tracking over your toes and you're not letting that back round.
And there's so many variations of squats too. Front squats, back squats, goblet squats, Bulgarian split squats.
Yeah.
Each with its own unique benefits.
Exactly. It's all about finding the variations that feel best for you, for your body, and that target the areas that you need to strengthen.
Now, this might be a good time to remind our listeners that this is just a starting point. It's not about trying to do all of these exercises at once or pushing yourself beyond your limits.
Yeah. That's a crucial point. Listen to your body. Start slowly and gradually increase that intensity and complexity as you get stronger.
And if you feel any pain, stop, reassess. Pain is your body's way of telling you something's wrong, so don't ignore those signals.
Absolutely. Better to be safe than sorry. And remember, consistency is key. You don't have to spend hours in the gym every day to see results. Even short, focused workouts a few times a week can make a huge difference in your hip strength and your overall knee health.
And let's not forget about those everyday activities we talked about earlier. It's not just about dedicated exercise. It's about being mindful of how we move throughout the day.
That's right. Paying attention to your posture, how you walk, how you climb stairs, even how you sit at your desk. All the seemingly small things can really add up over time.
So it's about integrating these principles into our daily lives, not just relegating them to the gym or a workout session.
Exactly. It's about making movement a conscious and consistent part of our lives.
Well, I think we've covered a lot of ground today, from the biomechanics of the knee to the importance of hip strength, the nuances of ACL injuries, and even the brain's role in movement control. It's been a fascinating deep dive, and I'm feeling incredibly empowered by all this knowledge.
Me too. Me too. And I hope our listener feels the same way. You know, knowledge is power, and by understanding how our bodies work, we can make informed choices to protect ourselves, improve our movement, and just live more fulfilling lives.
So to our listener, if you're experiencing knee pain or are worried about ACL injuries, take heart. There's so much you can do to improve your situation.
And remember, you're not alone. Seek guidance from qualified professionals like physical therapists who understand that interconnectedness of the body and who can create a personalized plan to address your specific needs and goals.
What a powerful message to end on. Thanks for joining us on this incredible journey into the world of knee health and hip mechanics.
It's been a pleasure.
And to our listeners, we hope you found this deep dive informative and inspiring. Remember, movement is medicine, and by taking an active role in your own well-being, you can unlock your body's incredible capacity for healing and resilience. Until next time, keep moving, keep learning, and keep exploring.